Hey guys! So it's been a while since we've talked, and that is always the case because I'm always busy and I suck at keeping up on this, and I'm sorry. And you're also always here for my makeup, and that's because I'm typically going to be doing it anyhow, so I may as well talk to you while I do it. I hardly think of myself as a makeup channel, but if I'm going to be doing my makeup, I may as well utilize my time and record myself. So I've already gotten started because I had started filming and realized I forgot to turn my microphone on. What I was saying is that it's clinical time, baby. Finally got some word on it. So this is my fourth semester or my second year as a PMHNP student, and it is the semester that we start clinicals. Now this semester started 6 weeks ago. What is this? October, like late August it started? August, September, October. Yeah, that's about right. This semester started late August and it is now October 3rd. And we could have started clinicals the middle of September. So with all clinicals, undergrad, graduate, all of them, you need some basic paperwork and you need some basic, you need to have like blood work done, titers checked, tuberculosis tests checked, urine drug screens, and background checks. I've had 100 background checks in my lifetime so far because of nursing school, because of every semester or every year you need a new background check, and then jobs you need a background check. And I've had multiple jobs in my lifetime, and I just started the state job within this year. So I had the fall 2024 background check to start my program. I had a background check in April or May to start my state job. And then I had a background check late August to prep for this semester. Now, all my titers have already cleared me that I am appropriately covered for my vaccines and everything that I've done. So I went ahead and ordered my drug screen, and I ordered it through the school, through their website that they use. And that came back very quickly, and that was good to go. So then I had to work on getting my background check done. So the school I go to, they offer background checks occasionally. And I saw that they had one like the third week of August, something like that. And I didn't need it resulted until the middle of September. So I'm like, that should be fine. The last couple background checks I've had have resulted within like a week and a half. Perfect. I'll be caught up on everything. I like getting it done. I felt like I was on top of it. I didn't feel like I was pushing my luck in the slightest. Well, it turns out, I don't know, maybe everybody's getting background checks done right now. I'm not sure what the issue is. Maybe it's the government not running at capacity right now. But it took a month and a half to come back. So other students have been starting their clinicals since the middle of September. And I've been waiting and waiting and waiting. And finally, last Thursday, I got an email. Mind you, I've been emailing them and bugging them. Hey, just want to see if anything came back yet. Hey, it's me. I'm still waiting on this in order to start clinicals. Hey, what kind of information do you have for me? So finally, last Thursday, I got an email saying, hey, great news, background checks in, you're good to go. And that must have been the only thing. They kept saying, we're waiting on the school's leadership to approve some paperwork through your site, and also the background check's not in yet. Well, the background came in on Thursday, and on Friday at like 11 a.m., I got an email saying, hey, this is your clinical site. This will be your preceptor, and this is the owner of the site. You have 48 hours to reach out or risk losing your placement. Now, mind you, I worked Thursday night. I worked at my state job Thursday night, off Friday for my nephew's football game, worked Saturday night. Now, I didn't know when my clinicals would start. Honestly, it felt like they were never going to start. So I had two people from the ICU ask me to pick up shifts that week. Someone asked me to pick up their Saturday night. And I thought, sure, Friday nights are for football for my nephew. But Saturday should work. So yeah, I'll pick up Saturday night. And then somebody asked me to pick up Monday night. Why not? I'll pick up a Monday night, get off work Friday morning from my state job. I go to sleep and I wake up at like 3 p.m., which isn't a ton of sleep for normal people. Like if you consider 12 hours on a rotation, that is 3 a.m. for a normal person, and nobody's waking up at 3 a.m. Nobody's going to bed at like 9:30, 10 o'clock at night and waking up at 3 a.m. and calling that normal. I have a habit of checking my email frequently because I don't want to miss anything. So I notice at 3 p.m. that I got this email from my school saying, hey, you have 48 hours to reach out. So that got my attention, and I was up for the day then. So that got my attention, and I got up and I wrote an email to this company. It gave me my preceptor's name and email, and the owner of the company's their name and email. And it said, reach out or risk losing your spot. So, okay, I'm going to reach out right now. So around 4 p.m., I reached out to this company and said, hey, I'm Jess. Thank you for this opportunity. Just wanted to confirm my spot, blah, blah, blah. Now it's time to get ready for the football game. My nephew's a senior that Friday. So it was last Friday was senior night. And his whole family got to walk across, his immediate family got to walk across the football field, introduce him, say what he wants to do in life, all that fun stuff. So it was an early, like we got to the field early so we could all tailgate and have fun and be there for him. And we had quite the crowd. We had family from his dad's side fill up quite a few rows of bleachers, and then we had family from my sister's side, our side, fill up quite a few rows, and then my husband's family, his mom came, and my nephew has a good support system. I'm very proud of that. And while I am basically on my way to the football game, I check my email again. And this company has gotten back to me and they said, hey, great to meet you. Can't wait to have you. How about you stop in Monday or Tuesday and we can start getting your schedule and plan for like paperwork, that type of thing. We'll get that underway. So Friday at like 5:30 p.m. is when I find out that I need to be at the location Monday or Tuesday. And I picked up Monday night midnights. So that wouldn't work either. I mean, technically if I went in Monday morning, but the way it ended up, if I would have gone in Monday, I would have gone in Tuesday as well. So I agreed to go in Tuesday, and I tried getting my Saturday night shift covered and my Monday night shift covered because I really wanted to be prepared. It was finally real to me. It was finally starting. And I wanted to prep and prepare myself and kind of understand what assessments look like and what meds I might see and what this specific site does, which is it's a ketamine clinic for treatment-resistant depression and all that kind of stuff. And they also do transcranial magnetic stimulation and a lot of alternative type treatments for psych diagnoses. So I'm like, I need to look into this a little bit closer. So I'm trying to get my shifts covered. I did not get Saturday covered. I ended up going in. Not only did I go in, but I ended up being in charge. I haven't been in charge in months. And we have new everything. I guess the charge nurse carries an iPhone now, and it's got like the Vocera number on it, and it's got, you can like text the provider. It's pretty cool, but it's just, I was looking for things. We had rapid response I had to go to, and I'm like, oh, where do I get to that on this? It didn't feel normal for me. It worked out. It was fine, but threw me off a little bit. Okay, so I emailed back. I said, sure, I'll be there Tuesday at 9:30. They open at 9. I didn't know for sure what I was going to be doing. It sounded like I was just going to be setting up like my schedule, agreeing on some times, maybe signing some paperwork, that type of thing. So I didn't want to show up at start time and just kind of surprise them and be like, hey, I know you guys are just getting started, but let's figure things out for me. So I gave them a half hour, and I went into the clinic. Actually, let's go back a little bit. I already had my makeup on, but when I got the email that I could come in Monday or Tuesday to start, I had poison ivy over like 50% of my body. I had it on my shoulder. I had it on, you can still see the little, where I itched myself. That's just basically dry skin now. Poison ivy along my arm, down my chest quite a bit, and up my face. I thought I was getting pimples, and then it started developing into like hundreds of little bumps. So I'm like, great. I've been waiting for months to start clinicals, and now I'm covered in poison ivy. I'm covered. I didn't feel like my best self. I was anxious. I had a canker sore in my lip that really hurt. I had poison ivy running up my face, and I just felt like the worst version of myself. You know how those days go. Of course, now we're starting, but it's okay. I got a Medrol dose pack to clear up this poison ivy since it was spreading up my neck and face. I've never had to use steroids before at all, much less for poison ivy, but it was hanging on for a couple weeks at this point. It started on my arm and then just continued to develop. So started the Medrol dose pack Monday morning. And luckily by Tuesday, like things were looking pretty decent. I was looking okay to go in. I felt pretty confident when I went in. So I went in to the clinic on Tuesday, and the owner was busy with a treatment already. He was the one that had texted me back and said, hey, Jess, we'll see you this day or that day and get some things together. So I assumed I had to do some administrative stuff with him initially. But my PMHNP found me and pulled me into her office, and we just got started. She's like, let's just go. And I had a brief introduction to her. And I gave her a brief introduction to myself and my history. And she's like, okay, we've got our next patient, or we've got our first patient's telehealth, and I'll ask them if you can sit in, and we'll just start. So I just started on Tuesday, and I kind of liked that because I didn't have to worry at all. I got thrown right into it, and my PMHNP that I'm with is so nice, so nice. And she teaches at one of the other local colleges, psych health assessment, I think she said. So she kind of understands where the students are. It's not like she's just been in her practice for a long time and forgot how to be a student. She's with the students. She has that mindset already, and I'm thankful for that. She's been very nice, and I've only been at the clinic once so far. It's Friday. I went in on Tuesday, did 7.5 hours, and she only works Mondays and Tuesdays, so that will be my current schedule. However, I have to get 200 hours in by the second week of December, so I'm going to have to supplement some hours. So I had to email my instructor saying, hey, there's another PMHNP at this facility. Can I get them officially on board so I can pick up hours with them? And so that is currently in the works, which means I'll likely be at this facility 3 days a week. It's about 50 minutes away from me, which isn't bad. Overall, that's not bad. It gives me some time to drink coffee in the morning and decompress and, I don't know, listen to a podcast on the way there or study something on the way there. So I can't complain about that. But I'll likely be there 3 days a week in order to get all of my hours in because it took so long to get started on these clinicals. So overall, great start. I do have some concerns though. And I don't know if I don't know what I don't know, I guess, but I'm pretty sure I know that not all of this is how it's supposed to go. So like I said, it's a ketamine clinic, and the owner is a CRNA, and he is there administering the ketamine. They do infusions, they do injections, like IM injections, and they do intranasal Spravato FDA approved ketamine treatments. They also do TMS, transcranial magnetic stimulation. Very cool. I think those are the two big types of procedures that they do at this office that I've seen so far. I sat in for a couple of sessions with my PMHNP, a couple of patients, and I got some information down and started essentially. But periodically, I would get pulled out of the room to go like watch a ketamine setup or watch brain mapping for the TMS or to check out the charting system. Hey, do you have time real quick? Let me go over this charting system with you a little bit. Okay, so I'd get pulled out periodically, and that's definitely okay the first couple days to kind of understand how things run in this office. But I feel like if things keep going like that, like throughout my time there, I'll lose the main part that I need, which is time with my PMHNP, working on assessments and prescribing and all of that good stuff. Also, the owner, very smart guy, very good at his job, but also he's got big ideas, grand ideas. And he said when I met him, like, I don't always get social cues. So he presented me with some of these big ideas for how I could make the most out of my orientation or out of my preceptorship or whatever you want to call it. And I'm not super comfortable with some of the stuff he's presented. And maybe it's just because it was my first day, but he kind of presented an opportunity for me to take on patients myself and do like an initial intake assessment, an initial psych assessment, and see if they're appropriate for this type of clinic and see what they've tried before, and just call patients and do an initial intake over the phone. He said you could do that in the office here. We could set you up with the charting system and a phone and get some of these phone calls in, or you could even take it home and get some of your hours in at home and call up these patients and do an initial intake assessment. And I don't believe that's how the preceptorship typically goes. And I was kind of looking at my paperwork and emails because this is different than just nursing. It's different than nursing school where you're always observed, typically in a hospital setting. Someone's watching you put in your first IV. We already have some. I'm already a professional. I'm already licensed. I'm already registered. But I'm going into a provider role now, and I'm learning how to think like a provider and how to prescribe and how to change medications. And it's a much different role, and I think I need to specifically observe my PMHNP and see how she does things, and then start to incorporate my own ideas and eventually see some patients still with her guidance, like over my shoulder. But the idea is to eventually see patients on my own, make some decisions, and then kind of get the, yes, that's what I would have done, or this is what I would have done differently from my PMHNP preceptor. So seeing patients on my own and making intake calls and taking the work home, it felt not quite like a preceptorship, almost like a part of the company, part of the job, which I'm honored that he would trust some of that responsibility. It would have been double checked, of course. But I just don't think that is how I should be getting most of my experience. And he brought a lot of this up in person with me, and I kind of didn't know what to say. So I was like, That's an interesting idea. That would certainly give me some experience. And I probably egged it on a little too much when I probably should have mentioned the expectations for clinicals right off the bat, that I definitely need to be observing, and with my PMHNP specifically, because the preceptors, there's a certain outline. And while he is very smart and has his own, CRNAs, so many people aspire to be them. They have so much responsibility in their hands, not even depending on what type of job, with all of the jobs they do. But the field I'm going into is just a little bit different, and I need the different viewpoint on it so I can start thinking like a PMHNP. So I went home just kind of like, wow, that was so much. That was so much. Everyone was very encouraging. It was like a lot of big ideas right off the bat. A lot of, hey, great, this is how we can utilize you. This is whatever. And I just got to thinking, like, I'll roll with punches. I spent most of my time with my preceptor. I wasn't really uncomfortable that day. I got to see a lot of cool stuff. I did get to see the ketamine administrations, and I got to see mapping for the transcranial magnetic stimulation, and I got to see some of that therapy and talk to some of the patients. This was a very good experience, and I just thought, you know what, when it comes up, I'll just try and continue to roll with punches. And I ended up getting an email from the owner saying, hey, it was great to meet you. Here's some extra information on ketamine. Which is awesome. Wealth of information, knows where to get the good stuff, like the good information, the good studies and everything. So I will have to read over those before I go back in on Monday to show that I put my work into it. But he reiterated in the email that, hey, here's a list of intake questions that might help you, and we can talk about, again, taking on some phone calls and such. So at this point, I really felt like he had this idea. I'm the first student at this site. Like, I'm the first legitimate student. They have someone who works there as a registered nurse to help with the ketamine monitoring, who is also a student and will sometimes be able to get her hours in there. But as for like someone who doesn't work there, as for just a random student coming in, I'm the first student they have. So they don't have a process down. So I felt like I had to draw an actual boundary and say, hey, this is what the expectations are from my school. And while I appreciate the opportunity and all of the the opportunity and the enthusiasm and everything, that my hours need to be under my PMHNP, and I need to be observing and creating treatment plans and doing this. So I did have to formulate an email that I thought was professional and boundary setting, but appreciative, because I am appreciative. And that was so uncomfortable for me. So uncomfortable. But I knew I had to do it myself. I couldn't just go straight to the instructors and say, hey, I think maybe whatever. I think some lines were crossed in the communication when setting up this preceptorship. Like, no, as an adult and a professional, I have to take the first step myself. So I just formulated an email this morning explaining expectations as a student, and that I will be best served in the clinic physically, typically with my PMHNP, seeing patients and going from there. Now, like I said, the owner verbalized that he doesn't always pick up social cues, which leads me to believe that he needs direct boundaries, direct conversation, which obviously I'm bad at because I'm having a hard time getting this across to you right now. I'm trying to pick my words very carefully. But I think the email did that, hopefully. I haven't heard back yet, and I'm terrified, to be quite honest. I don't want to burn bridges with my first site, but I'm nearly positive that I'm not supposed to be seeing patients on my own or taking intake phone calls at home or doing anything like that when this is my very first preceptorship as a provider student provider, whatever you want to call it. Also, my preceptor, she kind of wanted to know why I was starting clinical so late. She's like, this is kind of a weird time to start, isn't it? We're like in the 6 weeks into the semester, because again, she teaches. So in her head, she was wondering if I was like a little scattered or didn't have my stuff together, wasn't ready, whatever. But she was very nice, and she's like, but then I saw you and I thought, this girl looks like she has her stuff together. I wonder why we're just now starting. And first off, that made me feel so good that I looked professional when I went in, at least. And I had to explain that I was waiting on paperwork and background checks and all of this good stuff, and kind of cleared up why I'm just now starting and why I've got to get my hours in on a rigorous schedule. So that's how things are going so far. Got my information very last minute, had to reach out and had to get some shifts covered, had to move things around, got started, had a great first experience, really cool setup, really cool clinic, very nice preceptor. And I think as long as I'm able to keep my boundaries. Now, if this is something that does fall within my scope as a student and future provider, I'll be happy to do it. I will push my boundaries. I just don't think that that is, I think I'd be doing a disservice at this point. I think that I know what I'm supposed to be doing, and that is not included. And I kind of brought it up with my preceptor, and she said a similar thing that, oh, the owner has tons of big and great ideas, and they don't all hit. And we just kind of have to go with it. And if we have to explain again what our roles are here, then we'll just make sure he knows that this is what we need to be doing and this is the experience you need. So she's got my back, and I really appreciate that. And like I said, it's not, the owner's not mean in the least bit. He's just bursting with ideas. And I am there for one specific reason. So although it seems very cool to have another person come into your practice, as, you know, already having years of, nursing experience under their belt, I am still there for a specific reason, and I have to stick with that specific reason. So we'll see how things go. The patients that we did see, it was very encouraging. I enjoyed talking with them and seeing how my preceptor talked with them and looking at the charting. I have to look a little bit deeper into the charting. My preceptor does things a certain way where she has like an outline for herself, and then she takes some of her charting home to kind of, I don't want to say perfect it, but kind of perfect it to make sure all of her bases are covered. As a provider, there are certain things that need to be checked, and she likes to make sure that she goes through, and by the time it makes it into the actual EHR, it's got everything that needs to be covered how she wants it covered. So I will likely be charting for her. I don't know if their EHR will allow me to chart as a student. So she did send me her format so I could kind of look at it and practice a little bit. And I should have one or two more clinical days of observation where I can practice a little bit. I still have to turn in my own papers, my own like patient interactions, but it seems like I don't need a ton of information for the one website that we use. But occasionally they will ask for a full case study of one of the patients. So that's where all the big info comes from. Otherwise, they just want an idea of what kind of patients we're seeing. So I think that's clinicals right now. We're in it. We're in it, baby. We're getting it done. I've got till December 13th, and we're just going to keep it rolling. I feel so much better about going in now. I feel like pretty well prepared. Patients are patients are patients. And I have talked with patients for years now. So there should have been nothing to worry about there. But it just seems different talking, not just observing symptoms as a nurse, like diaphoresis or vital signs or this or that, but putting the whole picture together as a provider. And that's where my concern was. And that's still, I will have a lot to learn about that. But I think with the right guidance, I think we can make that happen. So I will have to keep you updated on how things go as the semester progresses. So let me know what you think about my situation, what your preceptorship was like. If you're in school, I want to hear about it. I want to hear how you would handle this. And good luck with everything you've got going on. And we will talk later. Have a good week.